I'm going to repeat this a couple times as people are coming into the room. We have a lot of people RSVP tonight. So we're going to be a little boring at the beginning with lots of welcomes, and then it's going to get super exciting with our spectacular leaders who have joined us tonight. So for those who have just joined us, welcome. As you can tell, we're putting our first names and our city and or our state into the chat so we can show our powerful movement together, say hello to each other from across the country. I see New York, I see Florida, Indiana, Michigan, Southern California. Let's see, Oregon. We've got everywhere. Montana, hello, Washington State, Chicago, Louisiana. Look at all these places. Georgia, Texas, Cape Cod, Virginia Beach. Look at us covering the entire country. I just love seeing all of the states come in and all of your names. So welcome, welcome. As you can tell, we're putting our cities, our states, and our first names in the chat as people are coming into the room. And we are really excited to be here together. I'm Kristen Rao Finkbeiner. I'm Executive Director of Moms Rising. I'm part of the Moms Rising team, and I'm one of the over 1.1 million members, along with each of you. And I'm delighted to introduce our interpreter, Murtado, to share interpretation instructions for tonight. To you, Murtado.
Thank you, Kristen, and thank you, everyone. Bear with me. I'm going to make some instructions in Spanish for those participants who will be here participating in Spanish. Now, for all of you, if there are any comments in Spanish, please know that there's a feature at the bottom of your screen that allows you to put English, and in that way you can hear everything said in Spanish into English. Hola y muy buenas tardes, bienvenidas a este evento de hoy. En la parte inferior de sus pantallas hay un globito si se conectan desde una computadora para que escuchen toda esta fantástica reunión en español. Por favor, hagan clic en el globito español, o si se conectan desde un teléfono inteligente o desde una tableta, por favor, vayan a los 3 puntos donde dice más, seleccionan interpretación del idioma y español. De esta manera pueden disfrutar de esta reunión exclusivamente para todas ustedes en español. Bueno, muchas gracias. That's all for me. Back to you, Kristen.
Thank you so much, Murtado. Okay, you all, this is a webinar style experience tonight due to the high volume of RSVPs. That means we encourage your use of emojis. Give me some hearts. We encourage your use of the chat, which many of you are using right now. And also, we encourage your use of the question and answer function, which you can find at the bottom of your screen. If you have a question, put them in there. We'll try to answer them throughout and at the end. I'd like to thank Jada, Catalina, Geronimo, the interpreters, the Moms Rising team, and also all of our speakers. Today, we have 4 spectacular guest speakers talking about what's happening. So we're really excited to be here together because we marched, we're rising, and we're not giving up. A lot of people are saying, what's next after marching? Well, hello, we're here for you next after marching, today and every day. So we're excited to be in community together to learn about what's happening and, importantly, how we can all help both save democracy, lift our families, boost our economy, and get our country up and out of this crisis. So thank you for being here. Throughout tonight, we'll be putting some actions in the chat box, so pay attention to that. And it is now my great honor to introduce our first spectacular, amazing, wonderful speaker. Fatima Goss-Graves is a nationally recognized leader in the fight for gender justice, and she's an expert in law, policy, and culture change. She's also the president and CEO of the National Women's Law Center, the president of the National Women's Law Center Action Fund, and a co-founder of a legal defense fund. Let's give a warm welcome, a bazillion trillion heart emojis to Fatima Goss-Graves. Thank you, Fatima. Let's see those heart emojis. Thank you. Welcome.
Hi, I'm so happy to be here with the Moms Rising crew and all my favorite folks. Thanks so much for having me tonight, Kristen. And thank you for everyone who is here because we need you now more than ever. This is a really, really wild time in the history of our country. We have now rounded the corner into our third full week of a shutdown government. And I know many of you, if you are like folks in my networks, my family, my community, you're filled with a lot of worries. Donald Trump and congressional Republicans really drove this country towards a shutdown, all because they didn't want to do anything about the soaring health costs and health care in this country. And it's pretty scary to look out what that will mean for so many of us. You know, we have been in a situation where we have a Republican controlled government in the House, in the Senate, and obviously with this president. One of the few levers of power that Democrats have in this time is in this moment. And they are fighting like heck to preserve a key tax credit that helps over 90% of people on the Affordable Care Act afford health insurance. We know if that credit went away, that millions of women in particular, especially those who are low income, would immediately see their healthcare costs skyrocket and others would lose their coverage altogether. But we also know that it's not just them who will be harmed. It will be all of us. Many of us have seen our healthcare bills come in for next year already. We already know that our healthcare costs are going up because this government has been shut down. So you would think that they would be urgently working late into the night to ensure that there is a solution. You would think that the Republicans would race back into town and sit down and really figure out how to find a way together. That this would be the breaking point where everyone was actually governing for all of us. That's not what's happened so far. And instead, they've gotten to pretty dirty tricks. They've engaged in mass firings of federal workers. They have engaged in threat after threat. They've increased raids in cities. They've cut funding for cities, all with the hope that the more pain that people feel in this country, the more likely we will be in a situation where they will open the government and do nothing for any of us. Trump and Republicans are responsible for this shutdown. There's no two ways about it. They control the White House. They control both chambers of Congress. And the thing that needs to happen next is that Mike Johnson, who is the Speaker of the House, needs to come back off of his vacation and force the rest of the Republicans in the House to come back from their month-long vacation and get to work. They need to work in a bipartisan manner to ensure that 24 million people on the Affordable Care Act marketplace do not see their health care skyrocket. We need to ensure that 10 million women do not get kicked off of it entirely. And Congress actually needs to do the work to ensure that that big, terrible bill, that big, beautiful bill that they no longer want to call beautiful, that bill that gutted and cut Medicaid that will result in 10 million Americans losing their health care, they got to dive in and fix that too. If you've ever wondered whether it is a bad idea to give a president like Trump unchecked power and no limits, all you need to do is look at the teardown of that East Wing. Well, he shouldn't get to tear down this entire country, too. He certainly shouldn't get to tear down our healthcare. And all I know is that every day that Democrats are fighting for us in Congress is a good day. So we need everyone to remind the Democrats in Congress to keep fighting for all of us, to keep fighting for our healthcare, to keep fighting for our families, and to keep fighting for our future. And we need the Republicans to get back to work, to come off that vacation. Listen, I would love a month-long vacation too. It's time to come back. It's time to come back and get to work in the same way that moms across this country are working their butts off every day. I want to see them come back, get to the table, get a deal, and ensure that people in this country can have problems like the skyrocketing costs of healthcare solved. So I'm so grateful for all of you. The type of folks who get up at night and get to work are the folks that are going to get up in the morning and get to work. And I know you guys have been doing all you can. We need you in this stretch. Thank you so much. And thank you for having me.
Thank you so much, Fatima Gosgraves, National Women's Law Center. Everybody get involved with the National Women's Law Center. Stay involved, support, follow their actions, follow their leadership. Fatima, yay. Thank you so much. Let's give her so many hearts. Let's see more hearts, more hearts, more hearts. Speaking of hearts, it's now my great honor to introduce the next speaker who I'm really, really, really excited is here with us tonight. Monifa Bandele. She's the Senior Vice President of Maternal Health, and she's also Moms Rising COO. She's received numerous leadership awards and is a highly sought out speaker. I would like to give her a warm welcome and a million trillion hearts too. Let's welcome Monifa Bandele. Thank you.
Thank you. Thank you so much, everyone, for coming out. We really appreciate this. Every month, it's really our members that keep us fired up and focused on the work. So today we're talking about healthcare and we're talking about Medicaid. And so I'm going to talk about our maternal health crisis that we have going on and what the Republicans and the president are doing is impacting birthing people. So, as many of you know, because you may have been on previous calls, the United States is facing a worsening mental health crisis with rising rates of preventable deaths and persistent inequalities across race, income, and geography. Medicaid, which finances more than 40% of births nationally, is really at the center of this story. Restricted Medicaid eligibility and reducing state finance flexibility would have a profound consequence for pregnant and postpartum people, their families, and communities. In fact, cuts to Medicaid policy would ultimately reduce access for care for pregnant and postpartum people. And overall, the Congressional Budget Office estimated that 7.8 million people will become uninsured due to the Medicaid cuts. Evidence shows that without coverage, people are less likely to get care. Now, let's talk about those work requirements that everyone's talking about. Evidence on work requirements in Arkansas and Georgia already show that work requirements cause confusion among enrollees and loss of coverage for eligible enrollees, despite having existing safeguards. And although pregnant folks and caregivers are exempt from new work requirements, many will likely get caught in the confusion and the administrative hurdles required to prove their exempt status. So the CBO estimates that the decrease in federal Medicaid expenditures really extend to $1 trillion over the next decade. And this will be felt most by states that have expanded Medicaid, most of whom will experience federal Medicaid spending cuts between 10% and 20% over a 10-year period. And decreased funding and increased administrative reporting requirements will force states to consider further restricting of eligibility and or sadly reducing services. So continuing Medicaid coverage for pregnant and postpartum folks is critical. As the United States continues to have the highest rate of maternal deaths of any high-income nation, with most of these deaths deemed preventable and occurring disproportionately amongst Black and Indigenous people. Rural residents also have a greater probability of severe maternal morbidity and mortality compared with urban residents. In fact, all pregnant and postpartum folks in rural areas will not just the Medicaid enrollees, will see the impacts of Medicaid cuts because it decreases in spending. And this will accelerate the closure of obstetric services in rural hospitals, which rely on Medicaid funding to operate. So everyone would be impacted, not just people who receive some form of Medicaid. And rural hospitals especially depend for obstetric services. Births were the most, rural communities depend on hospitals the most for obstetric services because births were the most common reasons for a hospital inpatient stay in the United States in 2022. And the vast majority of births in rural areas occur in hospitals in 2023. However, rural hospitals have been rapidly closing their obstetric units with low Medicaid reimbursement rates, and the difficulty in recruiting and retaining providers are amongst the biggest challenges. So, the federal budget reconciliation law will really hurt Medicaid spending in rural areas by an estimated $155 billion over the next 10 years. So, what Fatima was saying is absolutely correct. We're fighting like heck, as she said. And it's because in this fight, we're actually fighting to save lives.
Thank you so much, Monifa. Let's give her some hearts. Let's give her some rounds of applause. Let's give her some emojis. Thank you for leading. We are putting 5 actions. We have 4 actions and 1 bonus action into the chat. We'll keep putting them throughout the night. We've heard from you that the 4th link is not working. It's a PDF, so we're going to test it out. You might have to copy and paste it into your computer browser. But let's give a thank you to Monifa for her leadership and for her advocacy and for her expertise. Woo! Thank you, Monifa. Next up, we have another super spectacular speaker because all we bring, hello, as Moms Rising, is super spectacular. I'm really excited to introduce Felicia Burnett. Felicia is the National Director for Storytelling Innovations and for Healthcare at Moms Rising. Throughout her career, she's worked to lift the voices of stories of parents in policy. And she came to us first as a guest to the Obama White House speaking about her own personal story. So she has lived all the aspects of advocacy, and we are so excited to bring in Felicia. Let's give her a million trillion hearts, lots of warm emojis, and welcome, Felicia Burnett. Welcome. Felicia, do we have Felicia?
I just saw her and now I don't.
I know. I just saw her too.
Let's see.
All right. Well, while we're finding Felicia, let's talk about these actions. So the first action, which I'll put in right now, is a quick signature to tell Republican leaders in Congress to stop the rising healthcare costs. Now, you might wonder, why are we saying tell Republican leaders in Congress specifically? Well, right now, as you heard, Democratic leaders are not in the majority. So the Republican leaders are the ones who are really defining what policy is voted on, what policy is not voted on, and what's happening. So right now, Republican leaders have shut down the government because they want to increase healthcare costs for 24 million people who are on the Affordable Care Act, up to 70% increased healthcare costs. That is not okay, people. And Republican leaders in Congress, as you just also heard, recently cut 17 million people off of Medicaid. Medicaid covers 40% of all births, the majority of people in nursing homes, significant numbers of people who have disabilities, and it covers all of us. It also covers, interestingly, our pipeline to become doctors. So right now, in order to be in a residency program, Medicaid covers the residency programs. So when we're talking about undermining Medicaid, we're also talking about what Monifa just said, undermining maternal health. closing hospitals of all sizes, including rural hospitals. Also, rolling back access for people who are needing healthcare access and making costs higher for all of us because it pushes more people into emergency rooms and pushes more people out of being able to get their preventative care early on, so we end up with bigger problems later. So it's really important. Jada just put in the chat, sign, quick signature, tell Congress to stop rising healthcare costs. And specifically tell Republican leadership in Congress. And if you can get like 5 of your friends to do that too, that would be fantastic because we need to grow this movement. And here's the other thing: Republicans, Democrats, Libertarians, Green Party people, people of all political persuasions actually want health care. It pulls sky high having access to health care across every state and across every place and across every political party. So what Republican leadership and Donald Trump are doing inside the Beltway, in addition to knocking down the East Wing, which they said they wouldn't do, is knocking down health care for people across all parties. And in fact, studies show that there are more people who are part of the Republican Party who are going to lose access to health care due to this than people who are in the Democratic Party. So now we have Felicia. I have shared lots of things. I tried to drop some interesting knowledge and information, but here is Felicia to share more about what's happening. Welcome, 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 Felicia.
Hi, everyone, and I'm so sorry. As soon as I was ready to talk, the signal dropped and kicked me out. I am just so excited to be here tonight with everyone, with such a powerful community of moms and caregivers today. I do have some slides. I don't know if Geronimo, if you're awesome. So I'm Felicia Burnett. I'm the National Director for Healthcare and Storytelling Innovations at Moms Rising. And that means that I get to spend a lot of my working day reading stories from and talking with incredible advocates about their personal stories and experiences and how that relates to public policy. And that's absolutely my favorite part of the job. So I know it's getting late, and I just want to make sure that folks are still with us. Or at least it's late here on the East Coast for me. Sorry. So just give me a hi or hello in the chat, and just, a little wave. Let me know that you're still here. So as I've been listening to these incredible speakers tonight, one thing that really stands out is that this is such a critical time to share your story with your community, in the media, and with lawmakers. And I just want to start by saying thank you to everyone who's already shared their experiences with us. I know some of you are on the call right now. I've seen your names, and you're showing exactly how powerful personal stories can be in driving change. And I'm just so excited to be here to talk with you tonight about the power of storytelling in the work that we do, and talk about how we can do more of that work together. So next slide. At Moms Rising, we know that stories have this magical ability to move people and to paint a vivid picture. They tug at heartstrings and they build a deep connection. And lately, families have been telling us in huge numbers that they're feeling stretched and that they want to join their voices together to make a difference. And we've heard literally from tens of thousands of people, their experiences, each one a window into what families are facing. And while facts and data are truly important, what really changes minds and laws are the real human stories behind those numbers. Stories are significantly more memorable than facts and figures. They have the power to change the direction and destiny of public policy. And it's important to remember that storytellers, like all of you, are your experts in your own experience. And when others hear experiences that sound like their own, it helps them feel less alone. So also, when lawmakers hear those stories, they can't look away. Next slide. So I want to share a little bit about how we use storytelling in the advocacy work that we're doing. At Moms Rising, we lift up parents and caregivers' voices in a number of different ways. We share your stories in our action alerts and on our blog. We share stories across the media and our social media platforms. And this is, through videos and posts. And these posts reach millions of people nationwide and around the world. We connect storytellers directly with lawmakers in meetings and at hearings and through written testimony. Earlier this year, Leader Jeffries shared 15 of our member stories in his record-long speech on the House floor. So we do this so that the decision makers really can see the real-world impact of their policies. And we'll also compile storybooks of all the written stories that are submitted. These are just beautiful collections of family experiences that we will deliver straight to members of Congress, so that the family stories are literally on their desks when they're making these decisions. I know that so many of you have also volunteered to deliver storybooks out in the district. We did a big action on that earlier this year in May. So thank you to everyone who volunteered to bring storybooks to your members of Congress. That had a big impact. So through this work, we've seen again and again that storytelling builds change because it builds connection and empathy and urgency. Next slide. Oh, I'm sorry, I forgot to talk about also videos. And this is one of the links in your actions is going to bring you to Soapbox. And we collect stories on all of our issues. And video stories are especially powerful. So I just included this slide here to show you that you can go to our Soapbox page and submit a story on any topic, even beyond healthcare. Okay, next slide. All right, so I want to talk about what makes an effective story and just give you a few quick lessons that we've learned. So first, it's important to be personal and specific. You don't need to share your whole life story, and really just a moment that shows what's at stake and what needs to change is the most important. We know that in today's attention economy, the attention is very limited. And so whether you're sharing something on social media or if you get a hold of somebody at your member of Congress's office, it's important to hit the highlights and the important pieces, but to keep it succinct so that your message gets through. Second, it's important to connect to a bigger why. And this is so that you can help people understand why your experience matters for others in your community, and show that this isn't just like an individual issue, that this is like a systemic issue and that you're not the only one experiencing the issue that you're talking about. You also want to keep it authentic. The most powerful stories really do come straight from the heart, from speaking straight from your heart. And you don't have to have perfect words. It's really just your real voice that needs to come through. You don't have to have everything written down or in the right order. The best stories are authentic and speak from the heart. And then finally, consent matters. And I know so many of us are caregivers, so many of us have little ones in our lives or parents who we're taking care of. So if you are sharing about your children or loved ones, it's really important to make sure that they're comfortable with it and that they understand how this story will be used. And whenever possible, it really is best for people to share their own story. I've been doing advocacy a very long time with my son and his healthcare story, our family's healthcare story, literally since he was 1 year old. He just turned 19. And this has been something that we've had to work through as we've grown up, like as he's kind of come of age and figured out like, oh, hey, that's my story. Like I've literally taken him to Capitol Hill to share his own story with members of Congress and worked through the consent piece of it because it is his story and not just my story. So next slide. I just want to take a quick moment to highlight a couple of our incredible storytellers who have done some great work this year to give you some examples of how we work with storytellers. First, the woman on the left, I hope you're on the call, Cindy. I understand if you're not, but she lives in Baltimore. She's a mom and a grandma, and a caregiver for her mother and her brother, as well as her grandchildren. She's an incredible woman. She's been a fantastic advocate for healthcare throughout the year and also for SNAP. She came to the Hill to testify at a hearing, and then has also spoken at several other events on the Hill with Moms Rising. And then the storyteller on the right, her name is Luna Rosado, and she's from Connecticut, so a little further from the Hill. And so she shared her story with us about Medicaid earlier this year and what a difference that it has made in her family's life. And a couple of weeks ago, her senator's office reached out to us, it's Senator Blumenthal, and he wanted to do a video with someone from his state. And so we were able to connect them with Luna, who recorded a fantastic video for them that they ended up sharing on their social media channel as well. And we would not be able to do this work that we're doing or be nearly as effective in the work that we're doing without the power that our volunteer storytellers like Cindy and Luna bring to our campaigns. So just a huge thank you to everyone who has been sharing their stories. Next slide. So as we've been dropping in the chat tonight, there's a number of actions that are ready for you to be able to share your stories. We'll be collecting stories across all issue areas. If you have a story, but it's not a healthcare story, if you go to our website, you'll be able to submit a story through our general story collection form and pick out which topic it's for. And then I want to leave you with one very important thing to remember about storytelling. It's probably the most important lesson I've learned, and that is that no one story can speak for everyone. And that is why it is essential for a diverse range of voices to speak out across race, geography, language, and background, because when policymakers hear that chorus of experiences, they can't dismiss us as a single issue or a single perspective. Together, our stories become undeniable. So whether you're meeting with a lawmaker or you're posting about your experience online, or you're just talking with your neighbor, remember this, that your story is your power. And when we lift our stories together, we create the momentum that we need for real change. And with that, I will hand it back over.
Thank you so much, Felicia. Let's give her some heart emojis. Let's give her some round of applause. Let's give her some love. Thank you. Thank you. As Felicia said, and as you heard, stories do several powerful things. And I have personally witnessed the power of story over and over and over again. One, they are a give a clue project to elected leaders who too often aren't struggling with healthcare because, hello, when you're a member of Congress, you get job linked healthcare. So they're a get a clue project that we share with elected leaders that actually outside the Beltway, healthcare is really hard to get and it's really expensive. So we need a national comprehensive healthcare plan that is affordable. So that's one, they give elected leaders a clue. Two, they give journalists a clue. Oftentimes journalists don't realize how bad it is out here, how hard it is to get affordable healthcare that's really good, how hard it is to pay for childcare, what's happening with maternal crisis in terms of health, and more. So they give journalists a clue. And then the third thing they do is really important, is they let each of us know we're not alone, because in the United States of America, we too often blame moms for things that are not our fault. But we can show that when this many people are facing the same type of crisis, the same lack of accessibility to healthcare, at the same time, we don't have an epidemic of personal failures. We have national structural solutions that we can and must solve together. And healthcare is one of those areas where the United States of America is way behind the rest of the actual planet Earth, all of the countries, in terms of having universal healthcare. So it's really important to share our stories. And here's a question I get. Do I have to write a story like really, really long? No, your story can be super short. My story, one of my stories, we all have many stories, is when I had my son, my first son, he was born with a primary immune deficiency. And I suddenly was faced with both having a job and having a kid who really had a significant health crisis. I didn't have any paid family medical leave like hundreds of thousands of people in the United States of America. So I was pushed out of the labor force. I lost my job, and then I started researching and realized that a bazillion trillion other people have had a very similar experience. So I'm not alone, and that really helped me understand that we together are the power that we need to make a better tomorrow, to make a better nation, which brings us to the Q&A. There's some really good questions in the Q&A. A lot of them center on how do we get Republicans back to work? How do we get out of this crisis? What's happening? I'm going to turn it to Monifa for the first answers on this question. What tactics are going to help bring back and build up democracy, Monifa?
One of the tactics that we use at Moms Rising is that we make sure that people are hearing from their constituents. So remember, no matter where you live, we need you to share your story because at some point there's going to be a lawmaker that your story can speak directly to either what they're saying or what they're not saying, or what they're doing or what they're not doing. So, because we have members in every single state in the nation, it's important that we continue to deepen that reach in each state because what we found, even in the fight this summer, when we were able to just change one vote from cutting health care this summer, it was in North Carolina because of the on the ground and in district pressure that member of Congress was facing nonstop. Storytellers, vigils, not only Moms Rising members, but partners across the state. So we've got to get really deep and very grassroots in the states. If you're in a state and you have one of these lawmakers that is determined, that's dug in their heels to fight healthcare, bring a friend, bring and recruit more people to tell their stories and to join Moms Rising so that we can direct that pressure at each lawmaker that thinks somehow this isn't going to impact their constituents. And we know many people have been doing that. They are showing up to town halls. I don't know if you all have noticed, but Republican lawmakers, many of them can't even have a town hall in their district because of what's happening with healthcare. So we've just kind of turned the fire up and make sure the fire is deep in the states.
And Monifa is exactly right. Of course, one of the things that we've learned is that it's not just one thing that makes change, it's multiple things together. So it's sharing our stories, it's going out and marching, it's making those phone calls to members of Congress, it's signing on to letters to members of Congress, it's making sure that you're registered to vote and that you vote when you get a ballot. It's making sure that you post on social media. You saw in our chat box that we are right now taking pictures of rising prices. Hello, coffee is up 33%. That is terrible. I personally need a lot of coffee every day, so I'm personally insulted by coffee being up 33%. Vegetables are up 40%. I'm also personally insulted about that. And washing machines are even up 12%. So we are having people take pictures of any price tag around you that you go, oh no, and then post it on social media, that picture of the price tag with hashtag Trumpflation. Yes, we made up a word, hashtag Trumpflation. So going back to the question, what is it going to take? It's going to take all of us doing everything, right? Making the calls, everything. Go ahead, Monifa.
No, I was also going to toss it to Felicia because we have active campaigns, right, that people can funnel into, and many of them we've dropped in the chat, but I want to make sure that Felicia can give people some specific directions about this question about Republican lawmakers.
Absolutely. So we have a lot of healthcare actions happening right now. The story that we have, the story link that we have in there right now is about rising healthcare costs, but that is because it's more general and it's going to cover whether or not your premiums are rising from the ACA or your employer-sponsored premiums are rising, or if you're losing Medicaid. There's also the Protect Medicaid toolkit, which is really critical to help spread the word about the cuts to Medicaid that happened over the summer. I also saw the RFK Jr. petition drop in there. We have seen unprecedented numbers of attacks on our public health and disinformation and misinformation. We feel strongly that RFK Jr. needs to go, so please sign on to that petition. And then also, I believe there's a call-in line, and if we haven't dropped that in yet, we can drop in that action link that we need folks to be calling their members of Congress. I happen to live in North Carolina. So I'm very proud, very, very proud that the coalition that we built up here, literally over the last 2 decades, getting ready to pass Medicaid expansion, which we finally did 2 years ago, finally, after like years and years of working together. That same coalition came together over this past year to put a ton of pressure, especially on Senator Tillis. We were showing up at his office. I was in his office in January, literally at the beginning of the year, with healthcare stories from North Carolinians talking about the risks to healthcare and cuts to healthcare, and the stories and the persistence of our North Carolina coalition that we've built here over the last 2 decades. I feel very strongly that is what helped encourage him to vote against gutting our healthcare. And it's something that can be replicated across the country. We have worked very hard to build relationships with other organizations and friendships and lift up the stories that we did actually a coalition storybook with a bunch of different organizations here and brought it to every single congressional delegation across the state, every single office that exists across the state. We brought stories, and it was the voices of health advocates in the offices across the state that really, I think, made a huge difference in the votes that happened earlier this year.
Thank you, Felicia. Thank you, Monifa. Thank you to everyone who is asking questions. We are now joined by our spectacular and final guest for the evening. We have Neera Tanden on the line, direct with you. Neera is the president and CEO of the Center for American Progress and the CEO of the Center for American Progress Action Fund. And before leading American Progress, she was the domestic policy advisor to President Joe Biden, director of the National Domestic Policy Council, and she's overseen some of the administration's signature achievements, including lowering the cost of prescription drugs and expanding health insurance coverage, which Donald Trump and Republican leaders are having under attack right now. And previously, she was senior advisor and staff secretary in the White House. Her resume is long. Her achievements are spectacular. We are so lucky and thankful to have her joining us today to share what is going on and what we can do about it. To you, Neera.
Thanks so much. I'm sorry I'm having slight technical difficulties in showing and being like on video with you guys, but I really wanted to be here to just say thank you, thank you, thank you. Moms Rising is an organization that so punches above its weight because you are telling the stories of Americans who are living with the healthcare crisis every single day. And one of our singular achievements in the administration was expanding healthcare for millions of Americans. And we did that by making it easier to afford the Affordable Care Act, making it is basically expanding the premium tax credits to make it much more affordable for working class and middle class Americans. And because we did that, we went from basically 30 million Americans having healthcare coverage under the ACA to 44 million Americans having healthcare through the ACA. And, this is a singular achievement that is under threat directly right now. It's under threat because these ACA premium tax credits, expanded tax credits, are going to expire. And when they expire, obviously you've heard a lot about how people will be paying double or triple for their premiums. But really, the truth is millions of people will go without healthcare they just had because they will no longer be able to afford it. And that is what we are fighting against. Republicans knew this was happening. Democrats tried to negotiate last year to extend the tax credits. They tried to negotiate earlier this year to extend the tax credits. And finally, they put a line in the sand then we're not going to give you our votes for this CR for keeping this government open if you are not going to address the dire threat of millions of Americans losing health care. And Moms Rising has been crucial over years to the ACA itself, to expanding support for it, to extending the tax credits, because moms are on the front lines of ensuring that their children have health care. And on top of ripping 16 million Americans' health care away from their actions on the really ugly, atrocious bill, to this, enough is enough. So I really wanted to say thank you to Moms Rising. You are a leader in this fight. Your voices are crucial. I do believe the voices of Moms Rising and moms across this country have been crucial to changing votes of Republicans. Tom Tillis, now and hopefully more over the next several weeks, where we really make clear to the country that enough is enough. This Republican onslaught on working families and their really just basic needs to afford health care, while they can dig up money to basically demolish the East Wing, they should be finding money to protect our health care. We know that they are making decisions that hurt us every day. It's time for them to make decisions that help us. And with that, I just want to say thank you, thank you, thank you. You guys are the best. It's great to be in solidarity with you. We are lucky to have you on the front lines, and I am grateful for all you do.
Thank you so much. We're grateful for your leadership. Thank you for joining us. Let's give her some hearts. Let's give her some emojis. Let's give a round of applause to Neera Tanden. Thank you, thank you, thank you. We are now nearly at the end of our time together. The main questions that we already answered centered around what we can do. We hope that one of the things you do is sign up with Moms Rising. We are your one-stop shop for action. We have at least 4 actions a week that we have considered and made sure that your time will have an impact. So when you sign up, it's free. We'll give you at least 4 actions a week of things you can do to help lift our country up and out of this mess. And the good thing is, you heard us all talking. There's a lot of things to do. There's calls, there's sharing your story, there's going to events, there's sharing Trumpflation on social media and other social media. There's marching, there's not giving up, there's persistence. But because our movement is so broad and so big, not everybody has to do all the things. If we can each do 1 or 2 things and invite 1 or 2 other people in with us, then we can actually change our nation for the better. We know this from history. So in closing, I'd like to invite Felicia and Monifa to share one thing that's giving them hope, so we go away from this time together with hope in our hearts and fuel for change in our souls. Felicia, to you.
I have to say, top thing that is giving me hope right now is all of the incredible images and news coverage of the No Kings March last weekend. It was so fun and so heartening to see so many people come out. Like, I was hearing from friends who have never protested a day in their life, and they were posting on social media and sharing video and speaking out for the first time that I've ever seen them speak out. So the No Kings rally was definitely something that sparked hope for me this past week.
Thank you so much, Monifa.
Well, I'm in a city, New York City, shout it out, where we've seen a record number of people turn out to vote this year. In fact, during our primary, we saw an increase in 30% in voter turnout. So that gives me hope that that means that we're going to be going into next year with a high level of civic engagement, and that the turnout to vote is just going to crush all the tricks of redistricting and all the tricks of gutting the Voting Rights Act and all the tricks of voter suppression that we are seeing day in and day out. I feel like those will be crushed by record turnout. And we're seeing that in local elections across the country. So, yes, to the rallies and the marches and sharing stories, but also what's happening at the ballot box.
100% agree. Also, what's giving me hope is all of you, everybody who's signed up to join us today, everybody who's taking action. Speaking of which, I'd like to thank Jada, Catalina, Geronimo, Felicia, Monifa, Neera, Fatima, the interpreters, and the Moms Rising team, and every single one of you for joining us. We'll be putting the actions in the chat one last time before we sign off, but we really want to say thank you so much. It is our persistence, our insistence that the only person in the United States of America who should be wearing a crown is Lady Liberty. That is going to be what changes our nation for the better. So I'm so thrilled to be in movement with you, to be here with you tonight. I hope you have a wonderful, spectacular rest of your evening, and I hope you have a great year. Let's get voting, let's get moving, let's keep persisting, and together we will be victorious. Thank you.